Alright, Mr. Joyner, my name's Benton. I'm going to do an assessment on you today.
Okay.
Washing my hands for your protection. Alright. Just going to get some vital signs on you to start things off.
Okay.
Alright. 138/78. Alright, listen to your pulse and your respirations. Let's see. Okay. Pulse is 100. Okay. Count the respirations. Respiration 16. Alright. And how tall are you, Mr. Joyner?
6'1",
And your weight?
150 pounds.
Alright, we'll check that on a scale later. Alright, do you have any history of skin problems? Any disorders of skin like psoriasis, eczema, dermatitis?
No, sir.
Alright, well we'll go over looking at your skin as we go over the rest of your body, but I don't see anything abnormal starting out. Okay, skin looks good and clean. Don't see any wounds on you. Any injuries lately?
None lately, no.
Okay. Some tone's pretty good, not cyanotic. See your hands here? Skin turgor's pretty good, no tinning. Alright, let's see, veins are pretty good. Let's have a look at your legs. Okay, no varicose veins here, no wounds, ulcers, no significant scarring. Okay, elasticity is good. Alright, do you want to lay back on the bed? Okay. Let's see, going to finish up here. Skin looks pretty good. Color's good, it's not too brittle, not too fine. Nails look okay. Alright, capillary refill is about 2 seconds. Good. Let's see, can you smile for me? Alright, facial symmetry is good. Let's take a look at some arteries here. Temporal artery. Alright, pulses are good, about +2, and they're even on both sides. Let's take a look at some lymph nodes. Let's see. Alright, preauricular, postauricular, cervical. Alright, don't feel any swollen lymph nodes. Sounds pretty good. Listen to your carotid artery for bruits. Alright, no breweries noted. Sounds good. Alright, I'll take a look at your eyes. I'm going to use my phone for a pen light since I seem to have lost mine. Alright, look straight forward for me. Alright, follow my finger. Don't move your head, just follow my finger to the side. Alright, pupils are equal around, reactive to light, accommodating. Just take the frontal position of the gaze. Look, the gaze look pretty good. And we don't have any nystagmus on the side. Good. Alright, Mr. Joyner, I got my Snellen chart together now, so we're going to take a look at how your vision's doing. I'll hold this Snellen chart back here and have you try to read the lowest line that you can see.
Okay. F-E-L-O-P-Z-D.
Alright, can you cover up your left eye and do that?
Okay. F-E-L-O-P-Z-D.
Now to the right.
That is going to be D-E-F-P-G-T-E-C.
Okay, so it looks like about 20/25 in your right eye and 20/20 in your left. Not too bad. Alright, let's see here. Alright, so I'm going to take a look at your ears real quick. Looking at them, they look symmetrical. Excuse me, leave back some gloves. Almost forgot. Ears are symmetrical, don't see anything abnormal there. I'm going to whisper a word in your right ear and see if you can tell me what it is, and I'll do the same in the left, okay?
Autumn.
Okay.
Winter.
Alright, good. Alright, now see any nodules or masses or anything? You ever had any kind of pain or problems with your ears?
No.
Any kind of medical diagnosis?
No.
Alright, looking at your nose, everything looks symmetrical. Don't see any lesions or nodules or masses. And looks normal there. You can breathe through one nostril.
Yes.
Do the other.
No.
Alright, everything sounds good. Any problems with smells? Any diagnosis there with your nose? No problems at all?
No.
Alright, can you open your mouth for me? Alright, everything looks good. Don't see any lesions, nodules, masses, any problems right there. Can you move your tongue around for me? Alright, good. Alright, let's see. If you don't mind, I'm going to have you take your shirt off and we're going to go over some things in that area.
Okay.
Okay. Start off with looking at your chest wall. Everything looks symmetrical. Don't see any lesions or masses. When you inhale and exhale, your expansion on both sides seems normal. I'm going to take a listen to your lungs and your heart. Starting with your lungs. Deep breath. Sounds good. You go to the back. Alright. I'm going to listen 2 more times in the back and I'm going to have you say E each time the stethoscope touches you, okay?
Okay. E. E.
Alright, everything sounds good there. No rails, no wheezes. You ever had any kind of breathing problems like psoriasis, like asthma, pneumonia, anything like any problems like that?
No.
Okay. So I'm going to take a listen to your heart. Everything sounds good there. S1 and S2 are audible. You don't hear any S3 or S4. No murmurs, no clicks, nothing abnormal. Any heart problems? Any congenital abnormalities? Any problems there at all?
No.
Alright. So moving on from there, we'll take a listen to your neck and palpate your neck. Listen for carotid bruits to start with. Alright. Artery sounds good, no bruise. Pulse is good, even on both sides. Trachea is midline and mobile. No swelling of the thyroid. Okay. Let's see. Going down the checklist. Going to take a look at your cranial nerves here.
Okay.
Any trouble with your smelling? Okay. Just tell me what you can smell here.
Smells kind of peachy and fruity.
Good. Alright, that's your cranial nerve number 1, your olfactory, that's good. And we already tested your vision, so we know your optic nerve number 1 is good. Or number 2, I should say. Can you follow my fingers? Alright, so cranial nerves 3, 4, and 6 are good. Cardinal positions of gauge are good. That's your oculomotor, your trochlear, and your abducens. That's working fine. We already checked your smiles earlier, but you can go ahead and smile for me. Raise your eyebrows. Alright. Number 6 is, or number 5, trigeminal is good. We already tested your ears. Your acoustic nerve is good. And we already tested your tongue, so your glossopharyngeal is working fine. Can you shrug your shoulders for me? Alright, that's number 11. Your accessory, that's working good. Alright, can you stand up for me?
Okay.
Just going to do some musculoskeletal assessments on you real quick, okay? Can you take my hands, pull me towards you. Push me away.
Okay.
Alright, good. Squeeze my hands. Good. Alright, and let's see, can you take your hand, your right hand, to my finger, to your nose.
Okay.
Back. Okay, same thing with the other hand. Good. Alright, now if you can, while you're standing straight up like that, hold your hands at your side, put your heel to your shin, and glide it down.
Okay. Okay.
The same thing with the other leg. Good. Alright, can you sit on the edge of the bed? Good. Alright, can you raise this leg up for me?
Okay.
Point it straight out. Alright, and pull me back towards you. And push me away. Like you're pushing the gas pedal of the car. Good. One of this lower leg, same thing. Alright. Good. Okay, and back down. Alright. Alright. Just going to have a look real quick at your legs. Go over this in detail. Take some checks on your peripheral pulses. Alright. So, looking at your legs, I don't see any moles or abnormalities in that area. However, I do see some looks like longitudinal scars, surgical incisions on your ankles.
Yeah, those are from my ankle surgery that I had 6 years ago. They lengthened my Achilles tendon and put an implant inside both of my ankles.
Alright, so can you roll your feet for me, like to the sides?
Not very much. That implant kind of stops me from doing that.
Right, so your pronation is pretty limited.
Yeah.
Okay.
Up and down's okay, but side to side's almost non-existent.
Yeah, almost no pronation is capable at all. Alright, that's good. I don't see anything other than that. No moles, anything that concerns you down here? Anything that's changed recently?
No.
Alright. Just going to take your socks off here for a moment. Alright, let's see. Alright. Alright, pulses are good in your lower extremities. Let's see if I can get any socks on. Cap refill. Oh, 2 seconds, pretty good. No abnormalities there. So we just got the surgery and the reduced range of motion from that.
Mm-hmm.
Considering that fixed a prior existing problem, that's rather really an abnormality.
Correct.
So you overpronated before, correct?
No, my feet would go flat when I put pressure down on them. When I lifted my foot up, it would have an arch again.
Gotcha.
And they called it obliteration of the sinus tarsi.
Alright. Alright, if I can have you lay back on the bed for me.
Okay.
Do one last assessment on your abdomen. Alright, looking over your abdomen, don't see anything abnormal there. Got a couple of moles, nothing that's changed recently. Okay. Alright, we're going to take a look further at your abdomen here. Just going to listen to your bowel sounds and some arteries down there, make sure everything's good. bowel sound good. Have any problems with your digestion, your going to the bathroom, any problems in that area?
No.
Oh, okay. Alright. Your iliac and renal arteries sound good. I'm just going to palpate your abdomen and tell me if there's anything that hurts, okay?
Okay.
Any problems in that area?
No.
Alright, everything feels and sounds and looks good there.
Mm-hmm.
You ever had any abdominal surgeries? I don't see any marks, so
No.
nothing done there. Okay. Let me sit up on the side of the bed for me real quick one more time, and we're going to wrap this up.
Okay.
Alright, so I'm just going to do a breast exam on you, and we normally associate that with women, but men are at risk for breast cancer, so we always want to assess that as much as we can.
Okay.
So what I'm going to do is I'm going to show you how to do it on both sides, then I'm going to have you do a return demonstration and show me how it's done, okay? So we're going to start in at the nipple and go out in the circle, palpating with the tips of the fingers, okay? I'm going to palpate all the way around. If you feel any kind of nodules, if they're cancerous, they tend to be immobile and painful, but that's not always a hard and fast rule. So anytime you have something like that, you want to bring it up to your doctor and let them know you have concerns about it. You go ahead and show me how it's done there, like I showed you.
Okay.
Alright, looks pretty good. You got any questions, concerns, comments regarding the assessment today?
Nope.
Alright, yep. Have a good one. We'll see you around.
All right. Thank you, sir.